Polycystic ovarian syndrome is a diverse and complex female endocrine disorder that affects more than 10% of the women of the reproductive age globally. The complexity of the PCOS can be estimated from the fact that it is cited as one of the top 10 misdiagnosed diseases globally, and at least 70% of the cases of PCOS remain undiagnosed in the primary care. PCOS emanates from the vicious circle of insulin resistance, androgen excess, and anovulation. Insulin resistance is intrinsic to PCOS and is the major contributor to its pathogenesis. Insulin's resistance affects both liver and other peripheral tissues like muscle and adipose tissue. Insulin resistance through hepatic and peripheral aspects lead to hyperinsulinemia. The increased circulating insulin levels at liver reduce the sex hormone binding globulin concentrations or SHBG. Reduction in sex hormone binding globulin concentration leads to increase in free circulating testosterone levels. At the pituitary, the elevated level of circulating insulin increases the luteinizing hormone pulse frequency and amplitude. Increased luteinizing hormone in turn leads to increase in androgen production in the ovary. Thus, insulin resistance and compensatory hyperinsulinemia lead to hyperandrogenemia. The excess androgens that occur in the body impair folliculogenesis or the maturation of follicles, resulting in menstrual disturbances and development of multiple ovarian cysts in the ovary. Using an insulin sensitizing agent that predominantly works at either the hepatic or the peripheral aspect will not take care of insulin resistance completely. Launching for the first time in India, a comprehensive solution to treat insulin resistance, Metitol. Metformin is well-researched, documented, and safe insulin sensitizing agent. Myo-inositol, an inositol derivative which acts as second messenger in the insulin signaling pathway. In Metitol, metformin activates the enzyme 5-AMP activated protein kinase or AMPK and thus inhibits hepatic gluconeogenesis and lipid synthesis, thus controlling insulin resistance at the hepatic level. Myo-inositol in Metitol increases the glucose uptake in muscles and adipose through GLUT4 translocation by activating the PI3K AKT insulin signaling pathway, controlling the insulin resistance at the peripheral levels. Metitol, a comprehensive solution to treat insulin resistance, also has a significant role in correcting ovarian dysfunction due to insulin resistance. Metformin in Metitol inhibits the activity of enzymes CYP17 in the theca cells and steroidogenic acute regulatory protein 3-beta-hydroxydehydrogenase in granulose cells, thereby reducing the ovarian androgen synthesis, increases the ovarian antioxidants, reduces the anti-Mullerian hormone levels, improves menstrual abnormalities and resumption of ovulation. Myo-inositol in Metitol improves the ovulatory function, increases the oocyte quality and improves oocyte maturation. Metitol, a comprehensive solution to treat insulin resistance. A comprehensive combination of metformin and myo-inositol to control insulin resistance. Metformin and myo-inositol also correct the ovarian dysfunction caused due to insulin resistance. Metitol, a comprehensive solution to treat insulin resistance, a boon for PCOS patients.